Good morning. This morning I'm going to perform or demonstrate the newborn resuscitation method. So the things that we're going to need for this activity and demonstration is first the two dry towels that we need to wrap and cover the baby, and the meconium aspirator. So we don't have meconium aspirator, so as if that it is a meconium aspirator. And we have the bug bulb mask and the ampo bag, and especially we need to have a stethoscope to assess the baby's heart rate. So the things we need to do is first assess the baby if the baby is asphyxiated. So first, the common signs of the common question that we need to answer is if the baby is term, the baby has a tone, the baby is breathing or gasping or as absent of breathing, or the baby has a normal heart rate, especially is the baby meconium aspirated or meconium stained. So first thing that we're going to do is to dry truly the baby. Then make sure that we will remove the wet towel, and we will cover the baby with the towel to warm the baby. Next, we will assess the baby's tone. If the baby has any tone, we will assess the baby's color, especially if there is the presence of cyanosis. We will assess also the baby's breathing, if the baby is trying to breathe or crying or gasping. And we will assess the baby's heart rate using our stethoscope. So, baby's heart rate. So we need to inform the heart rate of the baby to our fellow members so that they will know if the baby's heart rate is normal. After assessing, we need to determine if we need to call for help or other healthcare members to help us and assess us. So we need to press the emergency button to call for nursing stations. After that one, if the baby is not breathing, we need to position the baby in a neutral position. So in a neutral position, we need to look if the baby's head is parallel to the surface where he is or she is lying. So we need to look for this, and also we need to determine the baby if it. We need to determine if the baby. We need to make sure that the baby is not hyperflexed or not so relaxed. So assess for the baby's position, and if not so, if the baby is still not breathing, we need to provide 5 inflation breaths. So in making 5 inflation breaths, we need to make sure that we are using the right size of the bag mask so that it could fit the baby's nose and mouth. So in doing this one, we need to roll it over to the baby's chin and over the nose and the mouth of the baby. So we will do this we will give 5 inflation breaths lasting 2 to 3 seconds each. So we will hold this on a C and E position. So put on the baby's chin, the mask, roll over to the nose and the mouth. So because we don't have a large baby doll, so it is not in the exact amount at this moment. But we will put it in a C and E position of our hands, and we will give 5 inflation breaths lasting 2 to 3 seconds each. 1, 2, 2, 2, 3, 3, 2, 3, 4, 2, 3, 5, 2, 3. While doing this, we need to check if the baby's heart or baby's chest is rising. So it is one way to check if our ventilation, our inflation breaths is working. So after that one, we need to reassess the baby again, the color, the tone, the breathing of the baby, especially if now the baby is trying to breathe, or especially the heart rate of the baby using our stethoscope. Remember, if the baby still is not breathing, we need to assess another the baby's position in neutral position. So if the baby's heart rate remains below 60 beats per minute, we need to continue giving ventilation breaths for 30 seconds, but this time only lasting 1 to 2 seconds each. So we'll give it. We'll have again C and D position. We will hold it tightly so that the air will not go out. So 1, 2, 1, 2, 1, 2, 1, 2, and so on after until we reach 30 seconds. And after that one, we need to reassess the baby, especially the baby's color, tone, and the baby's breathing, especially the baby's heart rate using our stethoscope once again. So baby's heart rate. After the assessment and after giving the ventilations of breath, so if the baby's heart rate remains bradycardiac or below 60, we need to administer compression, chest compression. For the chest compression, the best approach is the encircling technique or the two-thumb technique. So we will put our hands and our thumbs on the baby in the internipple line just below the nipple of the baby, and we will have a 3-to-1 ratio compression. So we will compress the baby a third part, and we will do this for 30 seconds again. So we will do this 3 compression for one breath, every one breath, and we will have breath 2, 3. So we will first start in breathing, giving breathing, and then the compression. So we will give the baby this chest compression, breath 1, 2, 3, 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 breath, and so on after until 30 seconds. So if we were not able to use the encircling technique, we will use a two-thumb approach. We'll put our thumb here, the same position in the internipple line, and we will have the same ratio, 3:1, and compress the chest of the baby for 30 seconds to third. So we will put here our thumb, 1, 2, 3, breath, 1, 2, 3, breath, 1, 2, 3, breath. But again, remember that the most a better technique is the two-thumb technique or the encircling technique. So after that, we will reassess the baby, especially the breathing and the heart rate. So if the baby's heart rate remains below 60 or below 100, we will administer epinephrine or medications in the baby's umbilical cord. So remember that we need to cooperate with our other healthcare team members, and this is the resuscitation method for the newborns. Thank you for watching, and God bless.